Alright, my name's Noah, and I want to inform y'all about what steroids are and what they're used for. So for starters, over 1,084,000 people have admitted using steroids at least once. And they can be extremely harmful if they're not used correctly. But my hope is I can keep you aware how they can be used properly. I've done tons of research over this and made sure I made all the corrections I need to make, so I believe I can be credible for this speech. Steroids are drugs used to enhance bodily functions or features such as muscles, immune systems, and most other places on a person's body. For this speech, I will inform you about what steroids are, their medical uses for them, and their side effects. So first, let's talk about what steroids are. You've most likely heard the word steroids before, but some people probably don't know what steroids really are used for or what they are. According to dictionary.com, steroids are any large group of fat-soluble organic compounds as the steroids, bile acids, and sex hormones, most of which has specific psychological action. Steroids were made as medicines and they come in two different forms. Anabolic steroids are one of them. They make male hormones, and doctors give them to patients for things such as late puberty and loss of muscles due to AIDS and cancer. Sometimes, however, athletes use these to gain muscle without work to win. Corticosteroids aren't as controversial. They don't increase muscle build. They help with allergies and immune system diseases. Cortisone is an example, which doctors use to ease pain from allergic reactions from animal bites and other natural factors such as poison ivy. Prednisone is also a corticosteroid, which brings relief from things like arthritis and lupus, just to name a couple. In order to take these steroids, there are several ways you can do it. You can either take them orally like a pill, inject them into your muscles, or you can get them as a cream or gel and just rub it to your skin. Now we talked about what steroids are, let's talk about what doctors would use them for. When I first started this speech, I only believed that they were used for bigger muscles, more testosterone, but they really are used for a lot of things. One reason doctors give steroids is to temporarily reduce or eliminate inflammation. This is important for people with arthritis because joints can cause a lot of pain, swelling, and limited movement if not used correctly. When these steroids are taken, they're usually taken with a pill so they can spread throughout the body, or one shot that can help just one specific area. Steroids can also help with asthma. They reduce things like help your immune system by opening up your lungs more so you can increase your oxygen intake. These steroids can be taken through inhalers for routine care to reduce the signs of asthma and emergency asthma attacks. But during these emergency asthma attacks, nurses generally inject the steroids into the person's body to speed up the process of their recovery. Inflammation is a key factor in most fatal and not so fatal diseases. The use of steroids is becoming more and more common in doctors' prescriptions. Steroids can help with skin diseases such as eczema, psoriasis, and dermatitis, in which people use creams to just help the eczema. Now that we've discussed what steroids are and their medical uses, let's discuss their side effects. You've probably noticed by now that I've used the word reduced quite a bit in this speech. That's due to the fact that these are only temporary. They don't completely heal it most of the time. And oftentimes steroids are like this quote, "Be careful what you wish for because there usually is a catch." Injecting the steroids into your body can effectively get rid of the pain, but it can't cure the illness. Although steroids work differently in everyone, in rare cases, injecting steroids can cause infections, allergic reactions, bleeding into the joint, and in extreme cases, rupture of a tendon. Taking steroids as a pill can also be convenient to just heal the pain on the go, but the side effects are a lot more common than the injections were, such as acne, blurred vision, difficulty sleeping, and dangerous situations, osteoporosis. And finally, steroids used as creams and gels, although it's a good idea to help with skin conditions, they're the same as the others. They also have a ton of side effects, such as easier bruising, skin thinning, and tons of different rashes. However, most of these happen when people are under medical attention because they use it improperly, but are devastating if not treated. In conclusion, you have now learned what steroids are used for. My hope is that you also learn what they are, their medical uses, and their side effects. Remember that steroids are used to enhance bodily functions, such as features such as muscles, immune system, and other places in a person's body. However, don't use these drugs without supervision, and